Equine radiography review, VT&E, and final exam review. So for equine radiography, this is typically done in the field using smaller sized cassettes. The horses, if they need head, neck, lungs, abdomen, anything else, they'll often be referred to a specialty equine hospital. Most of our horses can be radiographed without restraint, but we may need sedation, especially for painful situations. So we might use something like an analgesic, an NSAID, like phenylbutazone or bute, or flunixin meglumine, Banamine, both NSAIDs. We may need to use like an alpha-2 agonist such as xylazine or dormicedin, ditomidine. And in those cases, then we may need to reverse them. Keeping in mind, if we use an alpha-2 agonist, we will often reverse with an alpha-2 antagonist. And once that drug is reversed or has worn off, then the pain control has worn off too from the alpha-2 agonist. So we may need to introduce additional pain control for animals in those situations. Distal extremities, we can pack the frog and the central sulcus with hoof packing material such as Play-Doh. That way we're avoiding air artifacts when we're taking our radiograph. And I really like these two images here because it shows the internal anatomy as well as what we would be seeing from that radiograph. Often best practice is to remove the shoe and the nails when we're taking these radiographs, but we need to make sure that we are going to have the owners be able to set up farriery, especially if we have something like a special shoe on that animal. Labeling is extremely important for us when we're doing these because all equine limbs look identical. The limb markers should be placed dorsally or laterally based on the position. Lateral for the DP, craniocaudal, caudal-cranial, and the oblique positionings. So make sure that you write this down. Make sure you put this on a flashcard. This is a really, really important point. All limbs look the same, so in our horses, and that can be extremely confusing what you're working with. Normal limb anatomy for our horses, being able to use all the names. The generic terms, the anatomical terms for our horses is very important. So here is some examples of like the PP, P1, proximal phalanx, the long pastern, and knowing what the names of these are. And sometimes it can help us by knowing what we would name these on our own hand as well. Knowing that the horses are going to be standing on P3. Common views, I love this image because it shows us where the head of the X-ray machine is and what the names are as we go across. 5 standard views at minimum of each distal extremity is commonly done, especially when we're doing like our pre-purchase exams. So we have the list right here. And for me, one of the best things that I do to study this, to know this, is I make a limb out of Play-Doh. And then I would look at this and be able to figure out naming the parts as I'm going across. So we're looking from the head of the machine out, and that's the direction that the naming goes in.